Good day, I'm Chrysal Andechosa, and today I will demonstrate my return demonstration about bed shampooing, which is important for maintaining hygiene, comfort, and self-esteem of bedridden patient, while preventing scalp infection and removing oil buildup. Before starting, first make sure to provide client's privacy. Second, introduce yourself to the client. Third, explain the procedure to the patient. And last is perform hand hygiene. Good morning, ma'am. I am Chrysal Andechosa. I am your nurse for today, and I will assist you for shampooing your hair. Can you state your name and your birthday, ma'am? So, ma'am, bed shampooing will help your hair healthy and also removes dirt. Before touching patient, make sure to wear a clean glove. Next, position patient into lateral position and put a rubber sheet. And if you don't have rubber sheet, you can use trash bag. Now place a towel above the rubber sheets and position your patient into a comfortable position. Now, line patient's chest with a towel. After that, put the cotton balls into the ears of the patient and put the damp cloth on the eyes of the patient. Next is prepare the water. Pour the water over the head of the patient until it's completely wet. And now we're going to mix the shampoo and water to the basin, and we will going to put this in the hair of our patient. So now lather it with your both hands, and after that, massage the patient's scalp. Now rinse the hair of the patient until shampoo will remove. And now, I will going to remove the cotton balls in the hair of my patient. And since I don't have a hair dryer, I will use a towel to dry my patient's hair. And we're going to remove the damp cloth and continue to dry patient's hair. Next is to brush patient's hair after drying it. And now remove the towel in the patient's chest. And remove the towel in the trash bag in patient's back. And after that, return patient into a comfortable position.
Good morning, ma'am. My name is Isabel, and may I know your name, ma'am, and your birthday?
I'm Chrysal Andechosa, in March 21, 2007.
So, ma'am, I will perform a tepid sponge bath to you, ma'am, which is para ma-reduce po yung body temperature sa inyong katawan. Okay lang po kayo, ma'am? So, first is we check the patient's body temperature using thermometer. So after that is we help the patient remove the top by having a blanket on her butt. Then I will assess the patient to remove her towel. We have a warm water here, and I will put it on this basin. And after that, I will wet this towel and put it on the patient's head. And on the axillary. So check this every 5 minutes and replace it if needed. So next is put this on the patient's chest. So next is we are going to sponge the patient's upper extremity for 5 minutes. Next is check the patient's body temperature. And then record it. So next is we're going to sponge the back and buttocks of the patient for 5 to 10 minutes. Then next is we have to sponge at the lower of the patient, ankle to knees and knees to thigh for 3 to 5 minutes. Get a dry and clean towel and pat it on the patient's body to dry their body. So we have to pat dry our patient's body to avoid chills. So that's it for today, and thank you.